Early?
2 minutes early.
Well, I had 12:15. Okay.
This is great.
Oh, it was 12:15. Wasn't it 12:30?
12:15. I had. Okay.
And when are we finishing?
What time do we finish?
Sorry?
What time do we finish?
It's 1 hour. Like
That's 1 hour.
Because if you want that something, maybe.
Yeah.
So we finish at what time?
Professor Maki finish at
1:15. Quarter past one.
1:15.
You see, I was working on an hour.
1 hour. We have 1 hour basically.
Yeah.
1:15.
What is starting? Where after that we start on
After that is lunch time.
We might be a little bit later
next-
than.
And
2 o'clock. Okay. So
lunch is from
We're laughing. I say I always like overnight.
please take your seats.
Hotel not moving.
We're going to start in a few seconds. So
Well, it's going to be about 50 minutes or so. Yeah, it might be 45. I think that's it. With interpretation, if they're having simultaneous interpretation, I need to slow it a bit.
Yeah, that's true. Yeah. Well, friends and colleagues, we'll now move on to the real start of the conference content, and I would like to invite Martin McKee to give the first keynote speech. Probably Martin doesn't need a lot of introduction. He is well known to everybody in the public health on the public health scene, and to many others as well, as a professor of European public health at the London School of Hygiene and Tropical Medicine, as one of the directors of the European Centre on Health of Societies in Transition, as one of the directors of the European Observatory on Health Systems Policy, as an editor of the European Journal of Public Health, and now as president of the European Public Health Association.
President-elect.
Well, you'll be a president shortly, and you already look like a president, so I don't think we have any issues there. As you know, Martin is, you could call him hyperactive. I mean, he has published 740 scientific articles. Last year, 89. These numbers are really out of your imagination. He has published 42 books and 127 book chapters, and he has a true public health profile, both in relation to what we call classical public health, looking into inequalities, the situation of vulnerable groups, and the new public health focusing on health care, on health policy issues, etc. He's always ready to contribute when he's called for. He is always providing best evidence and critical, engaging and challenging messages, and I really think he's the best possible choice for this opening session on impact of global economic crisis on migrant and ethnic minority health in Europe. Please, Martin.
Okay, thank you very much indeed, and that's quite an introduction to have to live up to. I'd like to thank a number of colleagues, some of whom, like Alex, are here in the audience today, who have contributed to the work that I will be describing. But before I get into the particular topic, I want to step back a bit, because this morning I was talking to a Spanish journalist and asked, what should we cut? What in the health sector should we be cutting? And already the General Secretary has reminded us that in fact we need to look at the origins of the crisis. We need to think about how we got into this situation, and that will help us to understand what we should do to get out of it. So bear with me if the first part of this talk doesn't talk about migrants and ethnic minorities, but looks more generally at the economic crisis to understand the problem and some of the solutions. I want to take you back to 2008, to the origins of the crisis. Lehman Brothers, one of the blue chip companies in the United States, corporations, one of the scions of Wall Street, one of the groups that everybody looked to as part of the American financial establishment, announced that it had lost $4 billion. Because it was seen as too big to fail, the Federal Reserve suggested it should be liquidated, but then it also looked for some sort of a survival strategy. Barclays in the United Kingdom proposed coming in to buy it out, but the UK regulators stopped that from happening, and it did fail. It collapsed, it went into bankruptcy protection, and this sent a shockwave throughout the financial sector. Now this had enormous implications for the economy. What I've done here is to take the GDP per capita of these very different countries and put them all at a value of 1 in 2007. So they're indexed so as to all be in the same scale. And you can see that until the financial crisis, they were all growing. The situation was very promising. We could anticipate continued economic growth, continued money to invest in health and education, and continued happiness, essentially. But then the crisis hit, and everybody was hit by it. Germany initially weathered it quite well, but it then saw a decline in GDP, but it has now recovered, and the German economy is now not quite at where it would have been before, but it's getting close to it. The United States saw a collapse, but again it's on the road to recovery. Other European countries adopted austerity, and some of them, like Spain and the United Kingdom, have not recovered. They are stagnating. They have seen no meaningful recovery in their economy. Some of you may have heard from the United Kingdom that there has been some recovery in GDP in the last set of figures, but not in GDP per capita. The economy of the United Kingdom has grown, but only because more migrants have been coming in and generating money. Somewhat of a paradox, given my government's stance on migration. And of course, Greece, you know, has been the worst case in Europe, enormous problems. So I want to ask what was going on. You all read the newspapers, you all listen to the news and the radio and the television. You all know the answers, don't you? We've heard it again and again. This is what the media tell us, this is what the commentators tell us. They tell us that countries were living beyond their means, they were spending too much. Now we saw that economic growth had been rising, but they tell us that we misunderstood that. We had been spending too much. Spending had got out of control, we were told. The European model of the welfare state was unaffordable. We had been living far beyond our means. We had been spending money that we didn't have, spending it on people who were unproductive, the elderly, children, the disabled. In Britain, we had a saying that the national credit card was maxed out. It was as if American Express had written to the British government and told them that their card was cancelled. That was the analogy that was being used, although, of course, countries don't generally have their credit cards cancelled. And that's obvious, isn't it? You've heard this again and again and again. Every time you read the Wall Street Journal, the Financial Times, any of the major newspapers, this is the story. But is it? Is there an alternative explanation which is somewhat different? And I would propose to you that, in fact, if you listen to the serious economists and we look at the evidence, there is an alternative explanation. Let's go right back to the beginning. What we saw in the beginning, in the early part of the last decade, a whole series of things were happening. Western Europe, North America, had long ago stopped making things. Once upon a time, we had industries that made things. Ships, railway engines, cars, things like that. We no longer did. We had allowed that money, that industry, to go to other parts of the world, in particular to Asia, to China, Vietnam, and so on. That money in China had to go somewhere. It needed a home somewhere. Chinese investors needed somewhere to put their money. Russian oligarchs needed somewhere to put their money. And they were not prepared to invest in their own countries. So there was an awful lot of money floating around the world. There were low interest rates. The Federal Reserve, the Bank of England, the major banks in Europe had cut interest rates in response to the collapse of the dot-com bubble and in response to September the 11th, 2001, whenever there had been a stock market crisis. So interest rates were cut. In the 1980s and the 1990s, the banking sector had argued that it should be deregulated. It should be free to unleash all the energy that it had. Remember that in the 1960s and the 1970s, if you wanted to invest your money in a bank, you would have to go to that bank and make an appointment to talk to somebody. You wouldn't do it automatically on a stock market. Banks were boring in those days. They didn't do anything exciting. In fact, the bank manager was the exemplification of someone who was boring. You know, if you really wanted an exciting life, you joined the army or you went off to explore a far part of the world. You did not become a bank manager. That was not the aspiration of somebody who wanted to make a big difference. And on top of that, there was corruption. So all this money was floating around, looking for somewhere to go, and it had to be lent to somebody. Now, who wanted to borrow? Well, in Western Europe and North America, industry wasn't borrowing because it wasn't making anything. So you needed to find people who would be willing to borrow money. Remember that for 3 decades, median income, median earnings, ordinary people had not increased at all. Their living standards had gone up, but their living standards went up because they worked longer hours, because more women came into the workforce, and because they borrowed money. They borrowed money against their houses. And in the United States, people would borrow money against houses that frankly were not worth the money that they had. It was what we called the subprime mortgages. So all of this money was invested in houses, and we saw house prices going up and up. And people found that they could earn more money, their wealth could increase more by putting their money into a house and letting it increase, more money than they could make from actually working. They were paying back the mortgages. They could afford to do that because the interest rates were low. But when interest rates went up, the housing bubble collapsed. The stock market collapsed. And then they discovered something very interesting. Because once upon a time, stock markets were places where you went to if you had money, you invested in something that you could touch, you invested in a railway system in Argentina or in a cotton factory in the north of England, something you could physically go and touch. But with the deregulation, all of the banks and the financial sector had created complicated investments. So you thought you were investing your pension in a German pension fund, and you found that the money had actually gone all the way to owning some shack in rural Oklahoma by a very complicated way. Nobody really knew where the money was. So that's the problem. And we had politicians who saw the great benefit of deregulation. What has caused this Irish miracle, and how can we in Britain emulate it? In Ireland, they freed their markets, developed the skills of their workforce, encouraged enterprise and innovation, and created a dynamic economy. They have much to teach us if only we're willing to learn. I need hardly add that was written before the crisis. Who wrote it? Obviously somebody who believed in sound financial management. George Osborne, the British Chancellor of the Exchequer. Looking at the Irish miracle, sometimes you get things very wrong. Now, Of course, it really was quite easy, and it was only because we don't understand these things. We're all simple health professionals and involved in social justice. That's really our fault, because everyone in this audience, we now know much more about the economy, and you recognise this immediately. This is how to calculate the value of a credit default swap. And just to make it even easier, I thought I would put it in algebraic terms and in a diagram. So I suspect that everyone here can explain that. It's entirely simple, isn't it? Perfectly easy. Or maybe you think, I actually don't understand that. But if you don't understand that, I can promise you, you're not alone. Because effectively, this was what was happening. People in the financial services sector were reading the tea leaves. If they had been reading the tea leaves, they would have had as much probability of getting it right as doing these complex arithmetical calculations. And to pick up what the General Secretary was saying, some very rich, some very greedy, and some very stupid people were playing with your money and playing with complex derivatives that they didn't understand. And we had a whole dictionary of terms: credit default swaps, naked credit default swaps. And essentially that involves taking out a bet on your next door neighbour's house burning down. You have no financial interest in the house until it actually burns down. So you have a very strong incentive to light a very large barbecue as close to the fence as possible. All sorts of derivatives and hedging, mortgage-backed securities, subprime credit default hedges. Actually, the last one I made up, but did you spot that? The last one is an entirely artificial creation. You would not be alone if you failed to spot that. Now, you'll say at this stage, you've heard, you know I'm a physician, I'm a medic. What the hell do I know about any of this? How could I, I've studied anatomy and physiology, but I haven't studied financial markets. How could I have any idea? So I thought, what have other people said? Financial innovation has run amok, and in recent years, and some of the recently introduced markets and financial instruments have proven unsound and are now unravelling. The newly invented methods and instruments were so sophisticated that the regulatory authorities lost the ability to calculate the risks involved. The various synthetic financial instruments, which have played such an important role in turning the subprime crisis into a much larger financial crisis, have been built on a belief about markets. But the prevailing theory is wrong. Anybody know? Well, this is a man who does know a little bit about financial markets. George Soros. All quotations from him. So here he is, somebody who is one of the richest people in the world, has made billions on the stock market, and pointing out that essentially, just what I've said, people didn't understand it. Then there were other problems. Standard & Poor accidentally released a message to some of its subscribers that it had downgraded French debt from its top AAA rating. It had accidentally downgraded the debt. An accident. It's the sort of thing, you know what happens, you're in a rush in the morning and you turn around and you knock something off the table and you break a cup or something like that. I mean, accidents happen. And of course, this is a rather more important accident than dropping a cup or leaving the cat out or something like that. And this has given us a new term that has now got into the popular vocabulary, the fat finger syndrome, where you inadvertently press the wrong button, hopefully not with quite as catastrophic consequences, but where by pressing the wrong button you find that the market's going to free fall. It would be fine if it was only stupidity, but it wasn't. Goldman Sachs, gold-plated company, making massive fees for financial transactions, making 300 million arranging a 1 billion currency swap to allow Greece to get into the euro, concealed from the European Union regulators. Now, those of you who have held European Union research grants will know that all of your grants are audited, and audited in great detail. And you ask yourself, surely these were audited too. And of course they were. But they were audited by the same firms that were making money out of these obscure financial arrangements. This was full of conflict of interest. There was another problem in Greece as well, and that of course was that, how can I put it? Let me put it bluntly, the data were made up. It wasn't that the data were simply wrong, because then they would be wrong at random. There's a famous paper in the German Economic Review applying one of the checks you can use, a statistical probability of getting different numbers. The data were made up. Someone went to all the trouble of writing down on a piece of paper numbers taken out of the sky. Had they used the random number generator on their calculator, they might have got away with it. But they didn't. They simply made up the numbers. And this is the problem. The financial crisis was brought about essentially by people like this. And I'm not sure if all of you have seen the movie The Wolf of Wall Street with Leonardo DiCaprio. I recommend it. But if you do watch it, when you see that he was making billions at a time when he was largely high on cocaine, with really no idea what was happening, if you watch it, please remember, this is an allegory, this is a story, this is a warning. It is not, I repeat, not an instruction manual. This is not the way you should run financial markets. It's not a guide to what to do. It's a warning. Unfortunately, the warning came too late. So, given that I've firmly nailed my colours to the mast, given that I've demonstrated that I'm obviously a communist because I'm objecting to the system of Western capitalism, or at least the system we have now, not the system of capitalism we had in the 19th century, it actually worked to some extent, but I thought I would quote Vladimir Ilyich. The problem that we have is that there's a well-known mathematical relationship between the number of economists in a room and the number of opinions. So essentially, if n is the number of economists, the number of opinions is n plus 1. Because not all of them actually agree even with themselves. So we have a number of options. What do? It depends who you are. We have the monetarists, like Milton Friedman, expansionary monetary policy, lowering interest rates. If interest rates can't be lowered further, print money, quantitative easing. Quantitative easing is very good at keeping inflation down, and keeping inflation down is very good for making sure that those people who have the assets, the top 0.1% of the population, don't lose them. On the other hand, by lowering the interest rates, it's not good for pensioners, it's not good for poor people. But anyway, that's one way. Keynesians, who support the solution that got us out of the troubles in the 1930s, which is to spend money to encourage economic growth. It worked before, but it's not on the agenda now. And the supply side economists who want to deregulate and to cut taxes. Because if you take money, if you reduce the taxes for very rich people, we know that that will stimulate them to work harder. If they have more money, they will work harder. With very poor people, the same logic is that if you reduce their money, they will work harder. So remember that this doctrine is based on the idea that to get rich people to work harder, you need to give them more money. To get poor people to work harder, you need to take money away from them. Simple. Paul Krugman has pointed out that in fact none of these really apply at the minute. And we now have the doctrine of austerity, the Austerians. And he tells us that the next time you hear serious-sounding people explaining as they see it, the need for fiscal austerity, try to work out what their argument is. You'll discover that what sounds superficially like hard-headed realism is based on a foundation of fantasy. Now, of course, Krugman has a Nobel Prize in economics, as has Joe Stiglitz, and you will hear the neoliberal pro-austerity group saying, anybody can get a Nobel Prize these days. But they didn't say that when Milton Friedman got his. On the belief that invisible vigilantes will punish us if we're bad, and the confidence fairy, the credit rating agencies, the one that accidentally downgraded the French debt, the ones that got Lehman Brothers so badly wrong, the confidence fairy will reward us if we're good. And in the real world policy that will blight the lives of millions of working families, is being built on this foundation of fantasy. So, why are we having austerity? What is the rationale for it? Essentially, the people who argue for austerity, be they José Manuel Barroso, be they George Osborne, be they Angela Merkel, based their argument on two bits of evidence. They say if you have high levels of national debt, it will reduce future economic growth. And they also say that if you have high levels of government expenditure, because governments, they say, don't know how to invest money effectively. Look at the Soviet Union. It will crowd out the more productive private investment. So what's the evidence? Well, this is the famous paper by Reinhardt and Rogoff, quoted repeatedly in the early days of the economic crisis. And it said that it's okay if your debt to GDP ratio is below about 90%, but if it goes above it, as it has been in Italy and Japan for some time, and has been getting to it in some other countries, then they say that growth will be reduced. The rate of growth will fall. So that's a strong argument for cutting back on expenditure and cutting back on debt. Now, this was surprising when this paper was published in 2010, because other people, and people who are not normally seen as being on the left, Neil Ferguson, Adam Smith, the father of modern economics, Neil Ferguson said that the long-run experience would seem to fly in the face of such rules. He said that before the Reinhardt and Rogoff paper. Adam Smith obviously said it long before the Reinhardt and Rogoff paper. Great Britain seems to be able to support with ease a debt burden which half a century ago nobody believed her capable of supporting. So this suggests that maybe debt may not be quite as bad as it seems. So why did we have this difference in views? What was it that made Reinhardt and Rogoff conclude one thing when the economic historians had concluded another? Well, I go back to the Standard & Poor's downgrade of the French debt, because we all make mistakes. Things happen. And just a warning, next time you open an Excel spreadsheet, please remember to drag the cursor all the way down to the bottom of the column of figures. Because the data that Reinhardt and Rogoff used was analysed by a graduate student from the University of Massachusetts at Amherst, and found that they'd made a simple mistake. Now, we all do it. You're in the middle of doing calculations and you need a cup of coffee, or a brightly coloured bird flies past the window, or a small earthquake happens. I mean, lots of reasons why you might get distracted from your calculations. But please make sure that you check your figures and you have included all the data. Because when you do check Reinhardt and Rogoff's data, the relationship disappears. Adam Smith and Neil Ferguson were right all along. There is no relationship. So that's one bit of the intellectual argument shot out of the water. It just does not apply. And then this argument that public spending crowds out private investment. Does it? Well, Olivier Blanchard, the chief economist at the International Monetary Fund, recalculated what we describe as the fiscal multiplier. If I, as a government, spend $1, how much economic growth can I expect to get? And the orthodoxy was that I would get about 70 cents, less growth than the money I put in. He recalculated it during the recession and said, actually, I think it's about 1.6. So if you put money into the economy, it is likely to grow. And this suggests that perhaps if we increase government spending, it would make things better. We took these data, and this is Aaron Reeves, Sanjay Basu, David Stuckler, myself, a couple of colleagues, and we looked at it by sector. Does it matter where you spend the money? Yes, it does. Because if you put the money into health or education, where you're essentially putting money into the pockets of low-paid people who spend the money locally, who do not save it, but spend it in the local shops, and the local shops then spend the money on the local accountants and the local lawyers and the local carpenters and so on, then that boosts economic growth. By confidence intervals are wide, but for health we were getting a value of about 4. For education it was about 8. So a significant increase in economic growth. The one thing that spending money on does not work is spending it in defence. Now, I have to be a bit fairer here because, of course, it should have an effect. If you spend money anywhere, it should have an effect. The situation in Europe and in North America has, of course, been that we're not spending the money in Europe or North America. This money has undoubtedly given a major stimulus to the economies of Afghanistan and Iraq. Now, that may be a good thing, although it had other unexpected or expected consequences as well. But if you want to boost your economy, maybe you don't cut spending on these things at all. Now, I thought it would be helpful to look at what the IMF had thought about this. Olivier Blanchard has helped us. You will recognize this gentleman, Dominic Strauss-Kahn, DSK, and this was at the beginning of the crisis, and I thought he put it remarkably well. At this stage, he did not know what would be happening to him, but I thought, given that he knew this, he might have reflected a bit more on his behavior in New York hotels. When you lose your job, your health is likely to be worse. When you lose your job, the education of your children is likely to be worse. When you lose your job, social stability is likely to be worse, which threatens democracy and even peace. So we shouldn't fool ourselves. We're not out of the woods yet. And for the man in the street, a recovery without jobs doesn't mean much. And the economic results. Take the United Kingdom, which is down at the bottom in black, the USA up at the top in blue, in the Eurozone. We had, until the Conservative government came to power, an expansionary Keynesian solution. We cut indirect tax rates, we increased spending, and the economy was growing. The Conservative Liberal Democrat coalition came to power and restricted the money supply, and you can see what happened. The recovery was choked off. So what I'm saying to you is that we had a theoretical argument for austerity, which no longer holds. We had an empirical experiment, and we can see the results. So why are we pursuing austerity? A book that was written before the crisis by Naomi Klein points out how repeatedly neoliberal politicians have taken advantage of crises to undermine social solidarity. She described how they took advantage of Hurricane Katrina to introduce charter schools in New Orleans, how they took advantage of the Latin American debt crisis to privatize things, how they took advantage of the 2004 tsunami to tell the fishermen on the beaches of Sri Lanka that they no longer had land titles, so they were going to build a hotel on their beach, as if they were playing some grand global game of Monopoly, where they just thought anywhere that doesn't already have a hotel on it, we can just put one down. And other people had other motivations, and this was in the Financial Times. I lose track of days. I think this was it was Tuesday. Allegation, one of Jose Manuel Barroso's suggestion that even though Barroso knew what the consequences would be, he accepted austerity because this would align the European Commission with Germany, the strongest member state, and it increased the power of the Commission over governments' budgets. So there were lots of motivations, none of which had anything to do with health, none of which had anything to do with stimulating the economy, and definitely none of which had anything to do with vulnerable populations like migrants and minorities. So if the experiment was an economic failure, what did it do to health? What might we have expected? Well, we've done a whole series of studies. When we got to when we hit the financial crisis, we had a problem. Because I could go onto my phone and I could get financial data within seconds, a 15-second delay from Bloomberg's. I could get the value of the New York Stock Exchange or the London Stock Exchange. I looked around for mortality data, 2 or 3 years out of date, 10 years out of date if it was Belgium. Where were the data? We had no data to go on. Obviously, governments prioritized the economy over health. So we looked at historical examples. We looked at the banking crisis of the Great Depression in the 1930s. We looked at the last 30 years, crises in Spain in the 1980s, in Scandinavia around the time of the collapse of the Soviet Union. We looked at the collapse of the Soviet Union itself. And then in association with our colleagues at ECDC, we looked at infectious disease, looking at economic and political crises in a systematic review. To cut a long story short, on the basis of what we saw in all of these crises, we expected that suicides would go up, road traffic deaths would go down because people were driving less. Alcohol-related deaths, it depended. During the Great Depression in the 1930s, the United States had imposed prohibition. During the collapse of the Soviet Union, the country was swimming in alcohol. So it depends. Infectious diseases, almost impossible to predict. What did we find? Exactly what we predicted. Suicides had been falling, and then they started to go up again in every EU country apart from Austria. Road traffic deaths fell, although there were some countries like the Netherlands where they couldn't fall much more because they were already low. But where they could fall, they did fall. And infectious disease, we found the unexpected. Risky behaviours were more complicated. We found that overall alcohol consumption went down, work we did in the US and in the UK, but the prevalence of hazardous drinking, binge drinking, went up. Infectious diseases, I won't say too much about. It was complicated. Lots of different things could happen. But what about migrants and ethnic minorities? You say, at last he's getting to the topic of his presentation. But I think it's important before I do, to just recap. Austerity is a political choice. It is not an economic necessity. It's not even an economic good idea because it's making the economic situation worse. This is the longest recession in history, longer than the Great Depression, or getting close to the Great Depression of the 1930s. But for those who see the crisis as a once-in-a-lifetime opportunity to destroy the European welfare state, then, to quote Margaret Thatcher, this is a price worth paying. We would expect those who are already vulnerable, the people that we are concerned with in this meeting, to be most affected. But we have a problem. We have a problem because the people that we work with are often invisible. They have very strong incentives to avoid any contact with authority. These are vans at the top that were driven around the streets of London, essentially saying, well, in fact, explicitly saying, go home or face arrest. The Stasi never did this. Maybe they didn't have to. But it sends a very strong message. If you are an illegal migrant, don't come looking for help. These are people who are hard to reach in service. You don't even have to be an illegal migrant, as we'll see later. A lot of distrust by minorities. And the difficulty, of course, we have as researchers is to know that with these very disadvantaged populations, which of the problems they face now are because of the crisis, and which are because basically life has been pretty awful for them all along. So difficult. Attribution is difficult. Well, what do we know about infectious disease among migrants to Europe? And I pay tribute to my colleagues in ECDC who have been doing a fantastic job here among the international agencies in trying to get this onto the agenda. Mark has already covered some of this, so I won't say too much, just to say that well, in fact, you've already said all of it, so I won't bother saying anything. So what would we expect migrants and ethnic minorities, how might we expect them to be particularly affected? Well, in a number of ways. We would expect that perhaps cuts to measures that control the risks to which migrants are especially vulnerable might be bad. Cuts to services, especially those to vulnerable population. Cuts in living standards affecting those already vulnerable, including migrants. Exclusion of migrants from health coverage. Enhanced measures to control immigration with worsening condition to migrants. Threats to migrants because of of increasing xenophobia. All of these are possible. What do we find? What's the evidence? Cuts to disease control, HIV, needle exchange and condom distributions being cut, outreach programs to sex workers being discontinued. In Romania, no longer getting Global Fund money. A Romanian health minister stated that Romania would be better off paying for Shakespeare festivals than HIV prevention, although that was a step too far and he was forced to resign. Cuts to prevention programs. What happens? Well, intravenous drug use. The HIV cases have exploded in Greece, with predominantly among intravenous drug users, some of whom are migrants, and of course many of whom are not, but migrants of course are in that mix. This is the difficulty. We really don't have the data. There are big problems in distinguishing migrants from non-migrants. You cut back on prevention programs in Romania, and the decline that we've been seeing is reversed, entirely as expected. It is a complex issue, because still, at the present stage, most of those being affected in Greece are not migrants, but given their marginalisation and given the time lags between getting the data and between things happening and getting the data, we can expect that migrants will be especially vulnerable. We know that's what will happen. We should be doing something about it. And the policies that are imposed by governments are often counterproductive. Greek Minister of Health reintroduced controversial law stipulating forced testing for infectious diseases under police supervision for drug users, sex workers and immigrants, even though we know that this will deter marginalised groups from seeking testing. Malaria. If you stop spraying And if you stop vector control in a country that historically has had malaria, you can expect that malaria will return. And this, of course, is exactly what has happened, again with migrants, particularly migrant agricultural workers, affected. Cuts to services. Cuts to services disadvantage everybody. The poor, the vulnerable, regardless of whether you're a minority, an asylum seeker, everybody who is marginalised will be affected. But when we look in Greece, we see, and again the difficulty we have is knowing how much of this is due to the crisis and how much of this is due to the problems from before that. But 62% of migrants to Greece reporting unmet need for healthcare. 53% reporting major difficulties in accessing care, major barriers for the cost of care and the long waiting list. This is happening to everybody in Greece now, but it does seem that migrants are particularly badly affected. Cuts in living standards. As the economy declines, the first people to lose their jobs are often the migrants. And even those that retain some employment find that they have more precarious employment. Poor contracts, what we call 0 hours contracts, worse conditions, income loss, fear, anxiety. And I've calculated these data from a paper that's just been published looking at, in a panel survey, looking at people in Spain in 2008 and then followed up in 2011, showing how the prevalence of poor mental health increased substantially in all of these groups from Colombia, Ecuador, Morocco, Romania. Roma population, very little data. We know very little. We had a workshop this morning talking about some of the things that can be done. But what we do know is that Roma in some countries like Bulgaria are being disproportionately affected by job losses. Again, when the jobs go, it's the vulnerable populations who are disadvantaged most. The exclusion of migrants from coverage. A paper we did that provoked some controversy in this country. In fact, it provoked a lot of controversy going all the way up to the Prime Minister. Looking at how the current Spanish government has extended co-payments, increased existing co-payments, removed coverage from undocumented migrants and cut budgets. Now, almost 1 million undocumented migrants lost the right to comprehensive care. Many of them may no longer have been in Spain. We have to recognise that. Some of them may already have gone back to their own countries. But many did lose coverage. In theory, they retained emergency protection during pregnancy, childbirth, and when they were under 18. But in reality, and from this excellent report from Medicos del Mundo, in reality they faced practical barriers to getting the care. People didn't know how to interpret the rules. So we found, and they recorded over 1,000 cases, and I'm sure there were many more, of people who didn't have the right documentation, who were unable to access care as a consequence of the new rules. But it's important to say that Spain, which we criticise, and we criticise rightly, at least it did once provide care for undocumented migrants. And we often forget that other countries never did. So in Germany, we find that access to HIV treatment is provided, but civil servants are required to report undocumented migrants to the immigration department. They've tried to do that in the UK too. Doctors have said no. Many people, therefore, avoid treatment for themselves or their children. Many undocumented migrants have given up getting health care. Sweden, a paradigm of social democracy. HIV and AIDS testing only available to undocumented migrants after the cost is paid. Then we have the situation of migrants, illegal migrants who are detained. We have the Yarl's Wood Centre in the United Kingdom, a hellhole where someone committed suicide only the other day. But this MSF report catalogued what has been happening in one of the Greek detention centres. Because I'm a prisoner for a long time, I feel that my mind is not working well anymore. Excrement is falling from the toilets on the first floor to the ground floor. People are locked up inside almost all day. We're allowed in the yard 1 hour in the morning and 1 hour in the evening, and not always every day. Comatini is not a detention centre, it's a stable for animals. Those conditions are worse than on death row in the United States. Absolutely appalling. And the harassment that migrants face every day in Greece, Operation Xenia Zeus, since summer 2012, administrative detention has been used on a massive scale. tens of thousands of foreigners rounded up, taken to police stations to get their immigration status checked, just because of their appearance, just because they look different, even though a very small proportion were found to be in Greece unlawfully. Again, in Greece, a guy who was already 12 months in detention, he was told he would be released, but he was told that the law had changed and he would be kept in custody another 6 months. He went mad, stopped eating and sewed his mouth. People with untreated health needs. This is happening in Europe, in a European Union country in the 21st century. The question that I have to ask, as someone who, because of the nature of my work, has had to look at European history, is history repeating itself? Here we have the BNP, a fascist party from the United Kingdom, with 2 members of the European Parliament. The Vlaams Bloc. Here we have imagery at the bottom, the imagery associated with a party that won 21% of the popular vote in Hungary this weekend. 1 in 5 Hungarians who voted for a party that in the past has used the emblems of essentially the Third Reich. We have the rise of xenophobia and racial hatred, particularly as the white working class feel more and more vulnerable themselves because they have not seen any benefits in all of this period. So they look for somebody to scapegoat, somebody to blame, encouraged by politicians, encouraged by the media. Geert Wilders from the Netherlands calling out to a crowd, do you want fewer or more Moroccans in your city in the Netherlands? The crowd, fewer, fewer. Wilders, we're going to organise that. Where have we heard that before? Thankfully, that was too much for some in his own party, and his party has split. So some sanity can be seen. But for people like this to be mainstream politicians in Europe today, just think, isn't this quite incredible? Have we forgotten so much in the last century? And in Greece, again, the imagery. Okay, it's not a swastika. It's the symbolism of Golden Dawn. But you could be easily forgiven for thinking that it is. Even countries like Switzerland, we are told by this political party that the black sheep is not in any way racist. It's just some sheep are white and some sheep are black, and this sheep happened to be black. It's not in any way to be considered as an attack on migrants. And the one thing that unifies Belgium, one thing that Belgians agree on, foreigners. If we look at what has been happening in Greece, statement by Doctors of the World following attacks on clinics treating migrants, and they have made a stand. They have spoken out, and I give all due credit to them, and a number of their representatives are here today. We declare that we refuse to take fright, and we will staunchly continue to defend the right to health care whenever there are people. We deem that Golden Dawn bears moral responsibility for any potential attacks on our clinics may be subjected to in the future, and the relevant authorities will be notified. We call upon all Greeks, and I would say all Europeans who share the same solidarity principles, to support our efforts with even greater determination. And yet at the same time, an aide to the Greek Prime Minister is recorded as saying to a Golden Dawn MP, don't worry about the police investigation, nothing will happen. In the United Kingdom, we see exploitation of the crisis. A government in England, but not, thankfully, in Scotland, Wales or Northern Ireland, but in England, introducing a system of charging for migrants, where we are convinced that this is just the first step. Because the real issue is to put in place the mechanics. If you put a cash register into every clinic, into every surgery, then it becomes very easy to charge everybody. This is just the first step, and people really need to realise this. And with that, and on that depressing note, thank you very much, and I'm happy to take some questions.
Well, thank you very much, Martin, for this challenging and critical analysis. As expected, we got a lot of points to reflect on. You asked for questions and comments, and I'm sure that the audience will be able to raise a number of issues and questions, but I would recommend then that we do that over the conference while you're here, because the time is tight and lunch is already served. But we have a very tight program during this conference. Thanks to many people, it has been possible to establish a very exciting but also very tight program. I would like now to use the opportunity to thank the members of the scientific committee for all their advice and help in planning the meeting, and thanks to Maria Luisa Vasque and the Catalonian Consortium of Health that has really been very active and supporting and creative in establishing the program that we have now just started on the basis of this very challenging keynote lecture. There's now lunch from now on until 2 o'clock, I think, and then the program and the race starts. There are coffee breaks in between, but don't forget that some of the activities actually are starting at the same time as the coffee breaks. And I would like to remind you that this afternoon at 3:30, a workshop on chronic hepatitis is starting at the same time as the coffee break. So rush to grab your coffee and move on to the workshop and sessions as soon as possible. But now, time for lunch. Enjoy. Thank you.